Hello, this is Dr. Muhammad Ataullah, Senior Consultant Physician working at Care Hospital, Malakpet. Today, I will be discussing something about what is called as HbA1c. HbA1c is also called as glycated hemoglobin A1c. So this is a marker of average sugar levels of past 3 months. So usually this is done by NDSG parameters, and usually normal persons will have a HbA1c of less than 5.7. So there are two utilities of HbA1c. One is as a diagnostic tool, and number two as a tool of control. So whenever normal persons, I told you, has a HbA1c of less than 5.7, anybody who has a HbA1c between 5.7 and 6.5 is called as pre-diabetic patient. Previously, there were two terminologies which were called for this pre-diabetes. One is impaired fasting glycemia, and number two is impaired glucose tolerance. Now these two terminologies have been mixed into one category called the pre-diabetes. This is pre-diabetes, where you can diagnose somebody has a A1c between 5.7 and 6.5, we label them as pre-diabetes. Anybody who has a HbA1c of 6.5 is called frank diabetic patient. But the more important role of HbA1c in today's practice is the level of glucose control, detection of level of glucose control over the past 2 to 3 months. And you have to keep this HbA1c below 6.5 if the patient is young, and if the patient is older, has other comorbid conditions like cardiac disease or kidney disease, probably in such situations 7.5 or 8 HbA1c would be normal. So this is a marker of a good control. Suppose all of us ask our patients to get the HbA1c done at least once in 3 months, or if not once in 6 months, and see that the A1c is always below 7. So if the A1c is below 7, it gives us reassurance that the patient is having a good control. But one problem with HbA1c is it may not give you the present blood sugar levels. So it is an average of 3 months of blood sugar levels. Some people may have some high blood sugar levels during some time and low blood sugar levels during some time. But if you look at A1c, that will be normal. So this is an average of 3 months. So that is why what we do is we also ask the patient to do a self-monitoring of blood glucose levels occasionally, as well as the finger prick test with the glucometer occasionally, so that to verify whether the blood sugar levels are normal or not. So apart from this HbA1c, a new parameter is also coming into vogue, that is time in range. Time in range is nothing but what we want our patients is to see that they have a blood sugar between 70 milligrams to 180 milligrams at least 70% of the time, for which we need continuous glucose monitoring, and which is little expensive. But then over a period of time, most of the people, doctors as well as patients, will be put on this continuous glucose monitoring to have a good control. So we have so many things as far as the monitoring of blood sugar levels is concerned. You can do fasting post-lunch blood sugar levels, you can do HbA1c, you can do the time in range, and also some other parameters like glycemic variability are also coming up slowly. Thank you very much.